Patient Care Presentation by Stephanie Taylor. Background information. MG came to the emergency department after experiencing a fall off the toilet. She was in excruciating pain and unable to move her left leg. She is an 82-year-old white female. She lives at home with her son and granddaughter. Background continued. She has a history of seizures, dementia, acute kidney failure, atypical chest pain, osteoporosis, urinary tract infection, and hypertension. She had a left nephrectomy 10 years ago. She has never smoked and does not drink alcohol. Her current medications are Crepa, Cymbalta, Risperdal, Prolia, which she gets every 6 months to treat her osteoporosis, Percocet for pain, which she can have every 4 hours, Lisinopril, and heparin sub-Q. Background continued. MG is diagnosed using x-rays. She was diagnosed with a left hip fracture. She has emergency surgery. The surgery that she had done is an open reduction internal fixation of the left proximal femur. She has a catheter placed. Her dressing when she returns to the floor is clean, dry, and intact. Background continued. According to the CDC, a broken hip is one of the most serious injuries a person can suffer after experiencing a fall. Recovering from hip fractures is very difficult, and many people are unable to live on their own afterwards. It is expected that as Americans are now living longer, the incidence of hip fractures will continue to rise. Incident rates nationally. It is estimated that in the U.S., over 300,000 older people are hospitalized from hip fractures each year. These numbers are from people 65 years old and older. More than 95% of hip fractures are related to falls. The patient usually falls sideways, which is what happened to my patient. She fell off the toilet, landing on her left hip. Women experience 3/4 of all hip fractures. Women fall more often than men. Women are more likely to have osteoporosis than men. Osteoporosis is a disease that weakens bones and makes them more likely to break. As a person gets older, they are more likely to break their hip. In this picture, you can see what a healthy bone is supposed to look like and what a bone that is affected by osteoporosis looks like. The bone ultimately loses its density, making it more susceptible to break. Literature review. Fitzgerald et al. 2017. This article discusses how it is well documented that pain in older patients is frequently poorly managed in the acute hospital setting. It also discusses how the use of non-pharmacological strategies may improve pain management. Hewing et al. 2015. This article discusses how to decrease the incidence of pressure ulcers from occurring. Some of the ways that pressure ulcers are decreased are by pressure-reducing mattresses, regular repositioning, early mobilization, and heel protectors. Anuncio et al. 2015. This article discusses the most common post-op complications following a hip fracture, which are pneumonia, pressure ulcers, and deep vein thrombosis. These complications are most likely to occur in white women over 75 who have at least 5 comorbidities. Lim and Kuick, 2018. This article discusses how surgical therapy is the preferred method of treatment for patients with hip fractures. Nam et al., 2017. Elderly patients having major orthopedic surgery, such as a hip surgery, are at an increased risk of postoperative venous thromboembolism due to reduced mobility, multiple medical comorbidities, and recent trauma and/or surgery. It is recommended that a low molecular weight heparin be used as the first line to preventing deep vein thrombosis from occurring. They also recommended mechanical prophylaxis such as intermittent pneumatic compression devices and graduated compression stockings. Literature review continued. Prati et al., 2015. This article discusses how to reduce the incidence of deep vein thrombosis from occurring. They recommended using both chemical prophylaxis and mechanical prophylaxis. The chemical prophylaxis decreased the incidence of deep vein thrombosis significantly, and the two medications used were aspirin or enoxaparin. The mechanical measures were compression stockings, foot pumps, and range of motion exercises. Poussey-Reid, 2014. This article discusses pneumonia prevention. The prevention methods used were the frequent use of incentive spirometer, deep breathing, coughing, ambulation, early cleansing, suctioning if need be, positioning the patient in an upright position, and optimal pain management. Tan et al., 2015, discusses the use of non-pharmacological methods of controlling pain. Some of the methods in which used were in this experiment were music therapy, acupuncture, and hypnosis. By using these alternative methods, they were able to decrease the use of opioids in their patients. Went et al., 2016. Adequate pain relief is associated with reduced cardiovascular, respiratory, and gastrointestinal problems, as well as a lower incidence of delirium occurring following hip surgery. They use visual and analog scale to determine pain. They used pressure relieving mattresses at admission as a prophylaxis to prevent pressure ulcers from developing. And this study also found that early mobilization can prevent pressure ulcers, deep vein thrombosis, and pneumonia from occurring following hip surgery. Plan of care. My three main assessments that I did while caring for my patient were a neuro assessment, pain assessment, and skin assessment. During the neuro assessment, I had the patient wiggle her toes, I checked for pulses, I looked at the color and made sure that her sensation was intact and that she had no numbness and tingling. I had the patient plantar flex, dorsiflex, bend knee, and lift her leg. These all are important to identify a problem early to prevent further complications from occurring following surgery. My pain assessment was done and was an important part of taking care of this patient because she was in a lot of pain. When assessing pain, I checked the location, I asked about characteristics, was it radiating, I asked about the severity, and I asked how I could help the patient. The skin assessment. I inspected the skin all over the patient. The patient had a non-blanchable wound on her buttocks. In order to prevent this from getting worse, I implemented turning the patient every 2 hours, as well as she was incontinent, so I made sure to keep her dry. She had a pressure relieving mattress, and I had her ambulate to her chair. The goal during my care of this patient was adequate pain relief. Plan of care. The nursing interventions implemented to meet my goal of adequate pain relief were repositioning, ice, and music therapy. The outcome for this goal was achieved. Nursing care algorithm. I did my algorithm on pain. You would first start by asking your patient if they're in pain. If the patient says no, you can simply just document that the patient is not in pain. If the patient says yes, you should assess the pain. Some of the things that you would assess are the severity and the location. If the patient says that the pain is currently manageable, you would simply document. If the pain is not manageable, you could give the patient pain medication. After that, you would need to reassess the patient within 1 hour of giving them pain medication to see if the pain medication was helpful or not. If they are no longer in pain, you document that they're not in pain. If they are in pain, you can offer an alternative such as ice. Within 1 hour, again, you should reassess the patient. If they're not in pain, you document. If they are in pain, you offer another alternative. At this point, I offered my patient music therapy. When I went to go reassess the patient, about an hour later, I came into the patient's room and she was sound asleep. Therefore, I documented that the patient was resting with her eyes closed. At this point, I would say that the patient pain satisfaction was met. Summary. Over 300,000 elderly patients suffer from hip fractures each year. Hip fractures are associated with high mortality rates. Between 16 to 23% of those who suffer a hip fracture will die within 1 year of the injury. Most common complications are pneumonia, pressure ulcers, and DVTs following hip fracture surgery, and early ambulation can prevent pneumonia, pressure ulcers, and DVTs. Here is a reference list. Here is a continuance of my reference list.